So at the plenary session today at the American Society of Hematology of 2016, we heard the results of the GALLIUM study, which combined or compared obinutuzumab and chemotherapy versus rituximab and chemotherapy. And I think the study has been very eagerly awaited. We know that there are some differences between these two monoclonal antibodies, and certainly in CLL there has been a major survival advantage. But we've been somewhat surprised and disappointed that we haven't seen that previously in other types of non-Hodgkin lymphoma. So what was shown today was really a comparison in the treatment-naive follicular lymphoma group. So this analysis that included more than 1,200 patients showed that with a median follow-up of about 34 months, there is an advantage in the progression-free survival. It's from 73% to 80%. And this is with R chemo versus O chemo with a maintenance component with each of the monoclonal antibodies. I think the important takeaway points for this, there were several things in the presentation that did impress me, which was that all patients had to meet GELF criteria. So these were not your watch and wait patients, these were patients who did need therapy. There was rigorous pathology review, and I think those are really strong pluses. On a practice side, I think there's going to be some ongoing debate as to whether or not this should become the new standard of care. On one hand, you could say the progression-free survival has improved in a statistically significant manner. On the other hand, you could say that the improvement is somewhat modest, from 73% to 80%, and there was no difference in overall survival. So I think we will continue to debate the value, of these two monoclonal antibodies. But I will say that the statistically significant improvement will probably change practice for many physicians, and the rest of us will debate.